Data shows COVID-19 disproportionately affects communities of color. While here in Arkansas, a majority of our cases are among the white population, people of color are more likely to be hospitalized for it. I spoke with a professor at the Arkansas College of Osteopathic Medicine who tells me this only highlights a much bigger issue.
COVID-19 is just a symptom. It's a symptom that's diagnosing the problem of America.
That problem, according to Dr. Harvey Potts Jr., is racism. When you look at the 5 social determinants of our health, things like access to health care, employment, or food insecurity, Dr. Potts says the coronavirus pandemic has further exposed the lack of equity people of color face.
So when you look at those 5 areas, there's always been a disparity amongst underrepresented populations. And so the disparities that we see with COVID-19 were currently existing in America before the pandemic.
The current health crisis spotlights what Potts says doctors already knew. Chronic health conditions are greater among communities of color. It's these same health conditions like diabetes and stroke that put them at higher risk for other illnesses like the coronavirus. The University of Arkansas for Medical Sciences has been studying how race plays into the pandemic in the state.
We saw that African Americans in certain age groups were more likely to be hospitalized.
UAMS researchers found 1 in 4 blacks aged 60 or older who are COVID-19 positive have been hospitalized. They also found black people 35 to 59 positive for COVID-19 are almost twice as likely to be hospitalized as whites.
We would expect that our white Americans, particularly in Arkansas, because they're the majority, are going to have more cases. That's just how numbers are working out. But when we look at that severity of our hospitalization, we're seeing that African Americans, although we are a smaller proportion of the population, we're bearing a disproportionate burden of the severity and of the hospitalization.
Data UAMS Associate Professor Dr. Tiffany Haynes says is personal.
When we're talking about these numbers, we're talking about my family, my friends. It makes me want to work harder to figure out the why.
It's this why that leads to the how can we fix this? Dr. Potts says we need to trace the symptom, COVID-19, back to its origin, which he says is racism.
So our next move should be create anti-racist policies and processes and hold true to those policies and processes within institutions.
Dr. Potts would like to see hospitals recruit more minorities and enforce programs to help them advance their careers. Education, also crucial. At the Arkansas College of Osteopathic Medicine, Dr. Potts and other professors are teaching students to eliminate bias when treating patients.
It's not a fluke that the room that we're sitting in is a room that has an African-American high-fidelity mannequin, so that even in our simulated environments, they at least can acknowledge that other races exist and that you have to treat them with the same passion and empathy and compassion as you would anyone.
In a healthcare system that Dr. Potts says isn't colorblind, he's one of many working towards finding solutions, with the goal of having racism looked at as a risk factor, not race itself.
There will be generations who won't have to go through these things that we're experiencing right now if we stick to the long game and long view and be persistent with it.
Worth noting, according to the Centers for Disease Control and Prevention, nationwide people of color are more likely to die from COVID-19. But when you look at the numbers here in Arkansas, that's just not the case. You can see more of UAMS's research related to COVID-19 and race on our website, knwa.com.